Hi, I'm Susan Taylor with Scripps Health in San Diego, California. So you're in need of your annual checkup, or perhaps you just need a medication refill, or maybe a test for that nasty sore throat, or maybe you're looking for a more holistic approach to medicine. Who should you see? A doctor, physician's assistant, nurse practitioner, osteopath? There's a whole group of folks who make up your primary care medical team. Here to talk about who does what is Dr. Russell Zane. He is a family medicine doctor with Scripps Coastal Medical Center in Carlsbad, California. Thanks so much for being with us, Dr. Zane.
Yeah, my pleasure.
So what's the difference between a primary care physician and a family medicine physician?
So a family medicine physician is a primary care physician, as is an internal medicine physician who also provides primary care. So primary care physicians are kind of the first line which patients will call to access, and they can be made up of primary care physicians, which are internal medicine physicians and family physicians.
All right, so what's the difference between a family medicine physician and an internist?
Well, they're both doctors, they're both physicians,
Okay.
So that's probably the most important point. To the patients themselves, when they access a family medicine physician and internal medicine physician virtually do the same thing. So they will take care of patients, they will provide preventative care, they'll prevent chronic care, acute care. It's mostly in the difference in training. Internal medicine physicians provide care to mostly adult patients, though some will go down to about age 16, where family medicine physicians are trained to see patients from birth to all the way to seniors.
Okay, so a geriatric physician, though, for example, would that be a family medicine physician?
Typically, the geriatric physicians are internal medicine physicians, and they typically will specialize in seeing folks 65 and up, and some with more chronic conditions that may need addressing.
Okay, what would you see the internal medicine doctor for?
Just about anything that a primary care physician would see. You would see an internal medicine physician for preventative care. If someone has multiple chronic disease processes, you would see the internal medicine physician for that.
You're saying chronic disease, like give me an example.
Things like diabetes, high blood pressure, coronary artery disease would be some examples. However, those will also cross over, and family physicians will see the same types of problems as well.
Dealing with high cholesterol?
That's correct.
Mental health?
Mental health, that's a tricky one because, as there is a shortage of mental health providers and specialists such as psychiatrists, a lot of the initial mental health falls on the primary care physician, and so the first time a patient may see a person for mental health issues could be their primary care physician, whether that be an internal medicine physician or family physician.
What about family planning, breast exam, pap smear?
All of the above. Internal medicine physicians and family physicians can definitely provide those types of services for our patients.
And the pediatrician is age what to what?
So normally pediatricians will see babies when they're born, of course, and then they will normally see patients up to 18. However, some patients get really attached to their pediatricians, and sometimes in their early 20s. There are some pediatricians who will recommend transitioning their patients sometimes at an earlier age than 18. Others I've seen hang on to patients into their early 20s until they kind of tell them maybe it's time to transition to maybe an adult medicine.
An adult. And then what about the doctor of osteopathic medicine?
So a doctor of osteopathic medicine and a medical doctor basically have the same qualifications. They're both certified, board certified, and so to the patient, when they see a medical doctor or doctor of osteopathic medicine, will be almost identical with it. They're both highly qualified. They both go to medical school. The difference would be is the osteopathic physicians have a bit more of a holistic approach, letting the body heal itself. They also have training in osteopathic manipulation, which is more hands-on with that. So it's just kind of the philosophical model that they're both trained on.
So when you say more holistic approach, that's what, mind, body, spirit?
That would be correct, with that. But again, when you see an osteopathic physician or a medical doctor physician, you will have basically the same trained level of practitioner.
But does the osteopathic doctor, do they receive different training than a regular medical doctor?
Very similar. The medical...
Or additional training?
The additional training that they have is in what's called osteopathic manipulation. So that's kind of the hands-on manipulation, body manipulation, so hands-on type of healing.
What does that mean? Hands-on?
Basically where they're actually using manipulation where they are usually touching the body to find, and it's mostly in kind of orthopedic spinal types of things or musculoskeletal kind of concerns to do that.
And what about the role of the physician's assistant?
So physician's assistants and nurse practitioners in Scripps are used fairly interchangeably. They're advanced practice clinicians and they are highly trained folks. The difference is mostly in their training with that. So a nurse practitioner will have training through the nursing model, whereas the physician's assistant will have training through more of a medical model. They are both post-college and master's and postgraduate degrees, and they both have extensive clinical experience prior to getting their PA or nurse practitioner degrees.
But they're not doctors.
They are not doctors.
They're the doctor's assistant, physician's assistant, or the nurse practitioner.
That would be correct. That would be correct. So they're not doctors in the sense, but it's a matter of degrees. But they're highly trained and they're a vital part of our teams.
And then the role of the nurse practitioner?
The role of the nurse practitioner is to provide access for our patients. So in our care teams, the nurse practitioners will provide care. They can do physicals, they can see acute care types of problems. They help the teams with kind of incoming patient messages, addressing diagnostics with that. So they are, they kind of assist the team in basically improving our access for our patients.
Let's say I have a sore throat and I need to get it tested. Who would I go see for that?
You could see your physician, you could see your nurse practitioner, you could see your physician's assistant, and they would be all very qualified to help you.
But you don't necessarily need to see the doctor to give you a test to see if in fact you have strep throat, for example.
No, you do not, and that's where a lot of times the physician's assistants and nurse practitioners can really help us out with patients. Sometimes they may be able to see some of the acute care types of things that may be relatively straightforward, which would maybe free up the physician to see more complex types of issues.
Would a physician's assistant or a nurse practitioner see somebody, let's say, who has a sinus infection?
Absolutely, absolutely. They're highly qualified to see all types of acute care and preventative care.
Earache?
Absolutely.
Okay. We're going to come back to this in just a couple of minutes, so I want you to hold this thought. How does this team approach improve the quality of care for patients? We'll come back to that in just a couple of minutes.
Sure.
Talk about the primary care team. How do they all work in conjunction with each other?
So our primary care teams at Scripps have been designed to really keep the patient's best interest in mind and to be able to kind of maximize the quality of care that the patient is getting. It's basically a small group of health professionals working to the top of their qualification to be able to serve our patients in the best way possible. Patients like to see us in different ways. They like to see us in the office, but sometimes they don't. Sometimes they would rather call in, or sometimes they'd rather email us. And we have to be flexible and nimble enough to address access from any of their ways that they want to get a hold of us.
And what questions should you be asking yourself when you're seeking out which one of these primary care team members that you need to see, that you want to see?
I think it all kind of comes in kind of a funnel, right? Whether they call or whether they email. With that, a lot of times when a patient calls in, the care team will decide what is the best care team member to address the patient's question. So if it's a question about something clinical, whether I'm sick, do I need to be seen, that may be addressed by the nurse practitioner, or the physician assistant, or the physician. If it is, can I make an appointment, that may be handled by another care team member. So it just depends on what the incoming is. But usually if a patient calls or they email us, it goes to the care team, and then it's kind of separated out from there as to who would be the best qualified person to take care of it.
So you specialize in adolescent medicine and sports medicine. So let's say a person comes to you in their teens. Mm-hmm. At what age do you say, it's time for you to move on to an adult physician?
Never.
Never.
I will take care of them as long as they want to see me. I'll take care of them from teenagers to to senior.
And then what about somebody who is age 60 or 65? Should they then seek out a primary care doctor who specializes in geriatric medicine?
I really think it depends on the patient. I think the most important thing for a patient is really finding a physician that they feel really comfortable with, that they can feel like no matter what I'm going to go in for, this doctor understands me, I have a good rapport, I can tell this doctor anything that's on my mind, regardless of how simple or complicated or embarrassing or any of that type of stuff. So I think it's less about the type of physician as opposed to finding that physician who you find that right balance with.
So then let's go back. What are the questions that you should be asking yourself as you are making contact with this primary care team?
Sure. I think it's important for you to find out if that doctor is licensed, board certified, and some of that can be found on the internet, of course, and fortunately within Scripps that's all kind of vetted out ahead of time, so that's almost a given for us. There are some patients who want to see an internist for whatever reason. Maybe they feel like I have multiple medical problems, maybe I'd feel better with an internist. You might have a patient come in saying, you know what, I'm looking for a doctor, but I'm also looking for someone for my family as well. And so maybe you seek a doctor that may be able to provide care for the rest of your family. And that happens pretty commonly. I'll have a patient come in and saying, I'm basically on a scouting mission. I'm looking for a doctor to see, if the rest of my family can come to see this person so we can all be in one area. And that could be an internist or a family medicine.
Is there a benefit to that, to having one doctor see all of the members of the family?
I think there is, and I have a number of families in my own practice who I've been fortunate enough to see. It really depends on what the patient is looking for, though. Every patient's different. Some patients would prefer to have their own doctor be their own doctor and have their family members see some other one. There are other patients who are just very enthusiastic about having one doctor to see everyone because maybe it's more convenient.
All right, so we referenced this a couple of minutes ago. Let's come back to this. How does this team approach improve the quality of care for patients?
I think when you have a team of people focusing on your best interest, I think that means a lot. I think it helps with the efficiency of things, maybe getting your messages answered quicker. Maybe you have better access to that care team because you could see the physician, but maybe if that physician isn't available, the care team, nurse practitioner, or physician's assistant could see you. You become more familiar with the medical assistants and the nurses that work with that particular care team. With that, so you become more familiar with it. So I think it's a confidence type of thing for the patient, but I think also it's a quality, and also being able to get the answers that they need faster and more efficiently.
And that's really what that team approach provides. It's much more efficient for the patient, is it not?
Correct. It is, because you have, instead of one or two people looking at a certain patient's question or concern, now you have a whole team of people looking at it, and I think that makes it more efficient for the patient.
Any final thoughts, doctor?
No, I would just say that making sure that when you're finding a primary care physician, the most important thing is your communication, your ability to feel like you're in the right place, and hopefully at Scripps we have many physicians who fit that qualification.
Thank you so much. We appreciate you being with us.
Thank you.
If you would like more information on your primary care team, just please click on the link or go to scripps.org/videos. If you want more critical information about your health, we take care of you from head to toe. Please subscribe to our Scripps Health YouTube channel and also follow us on social media at Scripps Health. I'm Susan Taylor. Thanks so much for joining us. It's our mission at Scripps to help you heal, enhance, even save your life.